So in 2018, I was 24 years old and I had just started my second semester of grad school at Georgetown. And I had already been feeling chest pains that only got worse. I felt like I needed to get it checked out. And that's when an x-ray found that there was a mass in there. And even then, it was just, okay, it's a mass. We can surgically remove it. It'll be fine. But of course, through a CT scan and biopsy, we ultimately found that it was not benign. I was diagnosed with a type of non-Hodgkin's lymphoma, which is primary mediastinal large B-cell lymphoma. It's such a long name, but both my parents and I were just like, okay, what is this? Like, we've never heard of this cancer. I think that fear was really what prompted me to seek out Dr. Rappaport and see if I would be eligible for CAR T-cell. CAR T-cell is essentially a newer cancer treatment that takes your T-cells, and I like to say it turns them into mutant T-cells, killer T-cells that will then find and attack and kill, hopefully, all of your cancer cells. And unlike traditional chemotherapy, it for me felt like a one and done type of thing, and really a miracle, and is why I'm here today. I just remember feeling very welcomed and as if this could be very hopeful, as if it could be a fresh start. Because at that point, I mean, as with a lot of CAR T-cell patients, you've had to at least fail 1-2 treatment plans already. So people have already gone through a lot. And so just to hear that, okay, yes, like at least you have that chance to talk to a different team that may provide another treatment for you was very exciting. And so yeah, I just really appreciated how fast the team responded to me. They didn't make any like false promises or was trying to sell me anything. It was really just very matter of fact of like, yes, this is the treatment. These are the results from the clinical trials. There's basically a 50-50 chance, but at that point, 50-50 sounded great to me. Hearing just, all the facts laid out and also how welcoming and fast that they were to respond just made me feel very, a lot more hopeful than I had been previously.